Hi, my name's Meredith. I'm an occupational therapist that'll be working with you today.
Hi,
Nice
I'm
to
Claire.
meet you.
Nice to meet you.
Like to be called Claire?
Yes.
Today's evaluation is going to take about an hour, so if you need a bathroom break, a drink of water, anything like that, just let me know, okay? So I have access to your medical records and the referral, why the doctor sent you here, but I always like to hear in your words what brings you to OSU's driver rehabilitation program. You noticed that you arrived with a friend today.
Yes.
Did you drive to the appointment today, or did your friend?
My friend April drove.
Okay, and so I've got the medical history, everything that's going on with you, but I don't know much about you as a person. Tell me about yourself. Do you live alone or with someone? Have you had any trouble participating in your requirements as a student or as an employee?
No.
No, that's going well? Okay,
Mhm.
excellent. So what type of vehicle do you drive?
I drive a Toyota Camry,
Okay, and what model year is it?
2001.
All right, and is it an automatic transmission or standard transmission? Meaning, do you put it in drive and just go, or do you have to shift the gears?
I put it in drive.
Okay.
Yeah.
What age did you begin driving?
16.
Okay, and when was the last time you drove?
Yesterday.
Okay, and from age 16 to yesterday, was there ever a period of time where medical issues warranted stopping driving for any short period of time or a long period of time?
No.
No? Okay. Do you have your driver's license with you today? Just take down the license number, expiration date. Is there any restrictions on their license? That's the main part, and then I hand it back to them. And then I let them know the evaluation today. I have no authority over your license. I cannot issue nor revoke a license, and I say that as I hand it back to them. But what I make is a medical recommendation about your medical conditions in relation to your ability to drive. Okay. In the last 3 years, have you had any tickets or citations?
I have had a parking ticket.
Okay, and in the last 3 years, have you had any accidents, even minor fender benders?
Nope.
Excellent. Do you have any pain anywhere today? Pain anywhere on a regular basis, just not feeling it today?
No.
Okay. Do you wear hearing aids?
No.
Do you own hearing aids that you choose not to wear?
No.
Okay, and when was the last time you saw an eye doctor?
2 months ago?
Okay, all right. Do you wear glasses or contacts when you drive?
Yes,
And
contacts.
do you have them in today?
Mhm.
All right. So that pretty much summarizes the interview part. We may go more in depth based on some of the responses, but that's a pretty decent outline of it. The next thing that we do then is I discuss what to expect for today's appointment. We're going to do a vision screen. I'm not an eye doctor. I don't prescribe glasses or make diagnosis. I just do a basic screen similar to what gets done at the Bureau of Motor Vehicles whenever you go to renew your license. We just do a few more tests in addition to what they do at the BMV. And then we're going to do an assessment of how fast and how accurate your brain understands what your eyes are seeing. Then we look at physical capabilities to operate a car. How well do your arms move, legs move? You'll notice on the floor behind you, there's some pedals and then what looks like a traffic light up on the table. We'll be using that to assess your reaction time of your right foot going from the gas to the brake. And then we end with thinking skills.
Okay.
All right, any questions before we proceed?
No.
All right, go ahead and press your forehead again. Now as you look in there, do you see 3 columns of letters?
Yes.
Excellent. I'm going to make one of the columns disappear on purpose. What side do you see a blinking light?
The right. Left. Left. Right.
Excellent. You got all of those correct. Look at the middle column. Read to me row 4 of the middle column.
NSCH.
Next row down. That's all that the BMV does whenever you go to renew your license and you meet the state standards for vision and driving.
Okay.
Your side vision or your peripheral vision is at 85 degrees. What's required for driving is 70. And your nasal vision, or that kind of central vision of each eye towards your nose, scores intact. You're able to see at 45 degrees. Okay. The acuity or the clarity of your vision is fine for driving with your contacts in. And we're going to look at how you are able to judge distances. It's called depth perception. Take a look inside the machine. You should be looking at yellow diamond shapes. Look at the yellow diamond shape with the number 1 in the center of it. There's 4 circles that surround that number 1. One of those circles should look different than the rest, like it's floating towards you, or it looks thicker than the rest. Is it the top, bottom, left, or right?
Bottom.
Very good. How about number 2?
Left.
3? So for number 4, the correct answer is the top. And for number 5, the correct answer is the top. And that shows just a real mild impairment with depth perception, but at that level, it's not enough that it would have a huge impact on driving. Okay. Take a look inside that machine again and tell me, how many boxes do you see?
3.
Very good. That tells me that your visual fusion or your eyes team together as one unit. Next, we're going to look at your eye muscles. I'm gonna have you turn and face me. We can sit knee to knee. I've got a green eraser on top of that pencil. I want your eyes to follow the green eraser. Don't move your head, just your eyes. Great, your visual pursuits look terrific. Now, I'm gonna stare at the green eraser. I'm not gonna move it. You just continue to stare at it. Good, your eye alignment looks really good. Now I have a blue pencil and a green pencil. When I say blue, I want your eyes to find the blue pencil. When I say green, I want your eyes to find the green pencil. Blue, green, blue, green, blue, green. Yeah, that lets me know that your eyes can jump from one object to another really well and accurately. It's called visual saccades. All right, so we know your vision's great. Let's see how fast and how accurate your brain interprets what your eyes are seeing. I'm going to be timing how quickly you give your responses, but it's much more important that you get the answer correct rather than worry about my stopwatch. Take a look at the top figure. Find the match down below. You can point or you can say the corresponding letter, A, B, C, or D, whichever makes you more comfortable. That's what the next few questions are like. For your age category, we would want you to get 34 or more correct on that test. You got all 36 correct, so the accuracy with which your brain is interpreting what your eyes are seeing looks really good, really strong. The other thing that this tells me is processing time. How fast does your brain interpret information? For your age category, you'd want to be between 2.5 and 4 seconds. And when I average your scores, you fall well within that range. It tells me how fast and how accurate your brain is interpreting what your eyes are seeing. And driving is 99% visual. On a rare occasion, you may hear a siren or hear a horn that draws your attention to whatever that situation is. I said, but 99% of the time, you're responding to what your eyes are seeing. And that test lets me know how fast and accurate you can respond to what your eyes are seeing. As fast as you can, I want you to put your right hand on your left ear. Go. Yep, bring it down. As fast as you can, I want you to put your left hand on your right knee. Good, good. Just checking lefts and rights, you did fine, because when we go out on the road, I'll be giving instructions similar to that. At the stop sign, make a right turn. Make sure you can process that information. I want you to raise your arms up as high as you can. Go behind your head, out to the sides. Hold firm, don't let me move you. Good. Bring your arms in front. Hold firm, don't let me move you. Don't let me bend your elbow. Don't let me bend your elbow. Go ahead and bend your elbow. Don't let me pull you forward. Good. Don't let me straighten your elbow. Don't let me straighten your elbow. Go ahead and go palm up, palm down, wrist down, wrist up. Squeeze my fingers firm. Don't worry about hurting me. Good. So our manual muscle testing, our range of motion, it is a very general. If I have a client who has specific upper extremity issues, then we do the more comprehensive and more accurate positioning. But when somebody doesn't have any diagnosis that relates to the upper body, we do just that general screen. Okay? Now I'm going to come along and sit beside you. I want you to go up with your right knee. Don't let me push down. Don't let me straighten your knee. Go ahead and straighten your knee. Point your toe like a ballerina would, and then bring your toes to your nose. Very good. Don't let me move your foot. Good. Point like a ballerina. Don't let me move your foot. Very good. We're going to do the same thing on the other side. Go up with your knee. Don't let me push down. Don't let me pull out. Go ahead and straighten at your knee. Good. Point your toes like a ballerina. Don't let me lift up. Bring your toes to your nose. Don't let me push down. Good. And the lower body, we do in a seated position because as you're driving, you're seated. We look at the transfers, getting in and out of the car as part of the on-road evaluation, okay? Getting in and out of the sedan or the van, depending on whatever it is that they drive. And then that's when I really get a good look at ambulation as well, their gait, how well do they navigate this facility, leave the facility, get into the vehicle, out of the vehicle, do they get short of breath, does that wear them out? If they're in a wheelchair, we look at, particularly a manual wheelchair, does their endurance start to decrease when they have to do mobility within a building out to the vehicle, things like that. So a lot of the physical part takes place once we leave the clinical eval and go out to the vehicle. Okay? Go ahead and press on the gas. That's your start position. I control the red light with this button. When the red light comes on, I want your foot to come off of the gas and onto the brake as fast as you can. All right, let's practice. Good. 0.5 of a second. That's excellent. You want to be at your age somewhere in the 0.4 to 0.5 range, okay? Let's practice 2 more times before we start testing. Good. 0.5 again, very consistent. And let's try one more time. Good. Now your scores are fine. For somebody who's moving much slower than what their norms are for their age, then I generally give them what the range is that they would want to be in. I would give them a few more practice, and I would start to instruct them in a manner of, let's pretend a child has run out in front of your car, and in an emergency, you really got to get that foot over there quick. You know, try and coax them along, coach them through it a little bit, and then we do 3 for the testing. Okay? And then we record the average and compare it to norms.
Okay.
I'm going to give you 3 words that in about 5 minutes I'm going to ask you what were the 3 words I told you earlier. The words are plant, clock, rug. Can you repeat those now?
Plant, clock, rug.
Very good. I'm also going to give you 3 body movements that in about 5 minutes I'm going to ask you what were the 3 body movements I showed you earlier. They are, can you show me those now? Excellent. Remember those as well. I'm going to be asking you for them later. Okay. In the meantime, we are going to look at some driving scenarios. These come from a driver's ed book. Let's start here at this picture. All of these cars are heading in that direction on the highway. The yellow car has on his left turn signal because he would like to enter or merge onto the highway. Who has right of way, the yellow car or car number 1?
Car number 1.
Correct. Car number 1 has right of way because he's already on the highway, and the yellow car would have the yield sign. Although car number 1 has right of way, he could be a courteous driver and do something to allow the yellow car to merge on. What could car number 1 do to be a courteous driver and allow the yellow car to merge on?
Slow down.
That's one option. What's a second option?
He could merge to the other lane, to the left lane.
Very good. And what I'm looking at there is decision making, knowledge base of driving, but also mental flexibility. Okay. This is not a standardized test. There isn't one firm correct answer. So what I look at is when somebody gives me an answer that maybe I feel like, well, why? Why would you do that? Then they need to justify. Why would they do that?
Yeah.
Okay. A lot of the other things that you've seen thus far are standardized. So there's one correct answer and wrong answers. See the difference?
Yeah.
But in relation to decision making in driving, here in the clinic, there's no real standardized test that's going to tell you that yes, they're safe or no, they're not. This just gives me an idea of where they're at with their basic skill set. So now this is your steering wheel, and you're looking out your windshield. You see the red pickup truck at the side road. You see the bicyclist along this side of the road, and you see the car behind the bicyclist. As you enter into that situation, what could you predict could potentially go wrong?
The car next to the bike could try to go around and either come into my lane, or this car, the red truck, could pull out and hit them.
Very good. So for our novice drivers, particularly with the diagnosis of autism, it's very challenging for them to read others or to understand the actions of others or predict the actions of others. So this question, we use it with all of our clients, but particularly with our clients that have a diagnosis of autism, that's when I really want to get a feel for, can they predict the actions of others? Rather than predict the actions of others, they would start to say what they would do. Okay. What were the 3 words I told you earlier?
Plant, clock, rug.
Very good. What were the 3 body movements I showed you earlier? Excellent. Yeah, you got them all. And that is a subtest of the Cognitive Assessment of Minnesota. Now, that one is a standardized test. Yeah. And the amount of correct or incorrect responses, there's a set way to measure it. And if somebody cannot get one of the words, then there's a standardized 3 options that I give them that then they get to choose from. Okay. Now we're back to non-standardized testing, but just related to driving. I want you to take a look at this road sign. Just tell me what it means. And if you're not sure, there's 4 options over to the side of it. You said railroad.
Yield, do not enter, merge, no right turn.
Yeah, you got it. All right. The last test we're going to do looks at your attention skills. All right. I want you to place the pencil on number 1, and I want you to draw lines to the numbers in their proper order or sequence. 1, 2, 3, 4, 5. Give it a try. This is your sample or your practice. Try and keep your pencil on the page. I'm not worried about neatness. What I'm going to be looking at is how fast can you do this, and is it accurate, okay? Go ahead and turn the page over. This is the one I'll be timing you on. You can begin here now. Yeah, great job. You completed it accurately, and it only took you 23 seconds. Normal or average response time is 29 seconds. If it takes you longer than 48 seconds, we start to get concerned about your processing speed or attention skills in relation to driving, okay? Now it gets slightly harder. This time, you're going to see both numbers and letters on the page. I want you to alternate number, letter, while keeping them in their proper sequence. Give your sample a try. Yeah, you got the right idea. All right. Flip the page over, and you can begin here now. You finished that in 32 seconds. The average completion time is 75 seconds. I don't start to get worried about the driving unless this takes you more than 108 seconds, or if you make more than 3 errors. Okay, good job. So we're done with the clinical portion of today's testing. Just to do a review, your vision looks fine for driving. You meet the state minimum standards for driving. Your processing time and the way that your brain interprets what your eyes are seeing is both accurate and timely. Physically, everything looks fine for operation of a vehicle, and your thinking skills all scored within normal limits for your age. Good job.